So bone grafting, what type of procedures are you doing bone grafting?
Well, a lot of these procedures we do as far as bone grafting, we do some bone grafting to build up deficient ridges. Basically, when we've got thin bone and you're not able to place an implant, we're able to build that up to be able to place an implant in a place where you wouldn't normally be able to do that. We do a lot of bone grafting, say in the sinus as well, to build up that bone there, so we can place implants. And again, in places
You're using
where
what, like synthetic material? I mean,
we use a lot of cow bone and some donor bone as well.
Okay.
So that we find that combination, when you mix the two together, it works really, really well as far as getting the new bone that you really want. And a lot of times we'll end up mixing in with this the patient's own natural blood. We'll spin it down in a centrifuge and take the growth factors out of there, and we'll mix it in, so that gives us a better result, better healing, and everything heals up a whole lot better as far as that bone grafting goes.
Now, other dentists send you patients, and let's say that their implants were done somewhere else, and the implants are having a problem. Maybe they're going to lose their implant. You said that you do bone grafting on those type of cases.
We do.
Elaborate on that.
We do. Sometimes we're able to do those cases with just the laser, just to disinfect around them, but if the bone loss is too severe, too significant, we will have to do some bone grafting around those as well. And what we end up and do is we're able to disinfect around those implants using the laser to actually get rid of the infection, and then we're able to rebuild some of that lost bone with bone graft. And it's great. We've gotten really great results with it, and honestly, there's not a lot of dentists or periodontists out there that have the comfortable, they're just not comfortable treating these failing or ailing implants that are losing bone. And our practice, we're one of the few out there that's able to do it effectively and do it predictably.
So other specialists, other dentists are sending you their problem implant cases?
Yeah.
Okay.
Because implants, I mean, you see implants, they're placed by everybody all over the world. I mean, we've got general dentists placing implants, you got all sorts of different people placing implants, so the number of implants is going up, and some of these implants, they can get infected with these same bacteria that can cause gum disease, and once those implants start going downhill, start having bone loss, a lot of dentists, they just don't know what to do. I mean, a lot of them just, I don't know what to do. Let me take it out, let me just start from scratch again. But a lot of times we're able to save those implants. There was one lady who came in, she had all of her implants placed in Brazil. It was upper and lower full implants. The dentist said, you know what, you got to have all your implants out. You got to get all these implants taken out. There's no hope for them. You're going to be stuck in a denture for the rest of your life. You know what, she came into me. I was able to do the laser around some implants, do some bone grafting around some other implants. We were able to rebuild that bone. So now she's got her implant, she can still chew, she's got her regular prosthesis, and everything looks great and everything feels great for her too.
So let me get this straight. So the people that have no teeth, and they put in dental implants, so they had infected gums. So the gum disease is underneath the implant and kind of eating away at the bone, making the implant loose. So you go in with the laser and just kill that bacteria, and everything gets strong again.
So picture, as for an implant, they're shaped a bit like screws. So what you'll see happen is, once it gets infected, the bacteria go down the screw threads, and then the bone will basically just peel away from that implant.
Move away from the
It'll
implant.
move away from the implant, and it goes down, and then once it gets to the tip, that implant comes out. So we're able to actually eliminate that infection, kill those bad bugs that are actually causing that infection, that's causing the bone loss. And sometimes we're able to do that without bone grafting, but sometimes we end up doing bone grafting as well to rebuild the lost bone there. And it's a great technique to be able to do that.
Could a lot of this, in your opinion, be eliminated if they saw you first? I'm just saying, and saw you first, and you did your swab, you looked at what bad bugs they had, kill the bad bugs first, and then put in the implant?
Is
that what you do?
I will not place an implant in someone who's got gum disease infection. It's just not going to happen.
But they all have gum disease, don't they?
No, not everybody has gum disease. You can get rid of gum disease. No,
okay.
I mean you see plenty of patients that, I mean, if they've got, say, cavities. Say you lose your tooth because you've got decay and cavities. So you've got a patient like that, and I'd place an implant in that. But if you've got gum disease, you got to treat the gum disease.
So kill the bad bugs first and then do it.
We can do that a lot of times at the same day. I'll do the laser procedure first, and then at the end of the procedure, once all the bacteria is gone, I'll place that implant in a nice sterile, a nice disinfected field. And in that case, you don't get gum disease around that implant. Whereas a lot of guys, if they don't, say it's a general dentist, he doesn't treat gum disease really. You can scale them up as much as you want, but you're still going to have the bad bugs.
Clean them.
Yeah, you can clean them up as much as you want, but you're still going to have the bad bugs there. And then you place an implant in that. What do you think is going to happen?
Well, logically, this makes sense. I mean, doesn't every dentist know this? That before you put an implant, you really got to clean the area?
You'd figure that. But it's something that commonly gets done.
But in the future of implant dentistry, do you think they'll all be disinfecting the pocket a little bit more with the laser?
I sure
or
hope
antibiotics
so.
Before doing it?
I sure hope so. Do I believe that that's going to be? Honestly, that's what should happen.
But that's what's going on now.
That's what's going on now in my practice. That's what should happen. That's what's going on now in my practice. But you see it. I mean, that's how a majority of implants get infected. Is they get placed in a mouth that still has gum disease. And if you do that, you're setting yourself up for failure. That increases the risk of gum disease a huge amount on these implants. So, and you see all these implants failing, and it could have been prevented. And that's what we try to do.